Game.
Doc, si
Ay.
Miss Haranilia po ang mag-share ng screen.
Si Angel Rose.
Yes po.
Yes po.
Paki-forward ba sa kanya yung control? Okay na?
Wait lang po, Doc. Okay, let's start. Good morning, everyone, and to Doc Noel. I am Ana Tricia E. Pahora from Bachelor of Forensic Science 3A, and together with me is my partner, Miss Angel Rose Giranil. So for today's discussion, we will be presenting some concepts about poisoning. So before going straight to our topic, let me first introduce the contents of our discussion, which includes the basic concepts of poisoning. And we will also discuss 4 types of poisoning, in which some of them may be familiar to us and some are less common ones. So, and lastly, we will be concluding the presentation with some takeaway notes for us to remember. Next slide. Here we have the basic concepts of poisoning. So we have here the word toxicology, which is defined as the study of the effects of chemical, biological, and physical agents on living organisms, particularly humans. So the origin of the word toxicology came from the Greek word toxikos, meaning poisonous, and the word logos, which means subject matter. So therefore, when these 2 words are joined together, it may be termed as the study of poisons. Next slide, please. So in the field of toxicology, the main role of the pathologist is first to evaluate the poison as a cause or contribution to death. Second is their role is to exclude or confirm other non-toxic factors in the death of a person. And lastly, they will be collecting samples for analysis and interpretation based on the result, and the interpretation will be based from the knowledge and the history and clinical features, and also the autopsy appearances from the result. Next slide, please. Here we have Philippus Aurolus Theophrastus Bombastus von Hohenheim, or who we commonly known as Paracelsus, the father of modern toxicology. So he quoted that the dose makes the poison. So as we all know, marami po tayong substances na available as well as medication na available dito sa dito sa mundo. Pero ang poison po is nakaka-create lang depende po sa level or sa kung gaano kadami or kaunti ng ating nai-intake. Yan pa. Next slide, please. We have Matthew Joseph Bonaventure Orfila, or the father of toxicology. So he is known for his contribution in the field of forensic medicine. He also worked to make chemical analysis a routine part of forensic medicine, and he also made studies related to asphyxiation, the decomposition of the bodies, and also exhumation. So our main topic, which is all about poison, the word poison is described as a substance, maybe in a natural or synthetic form, and it causes damage to living tissues and has an injurious or fatal effect on the body, whether it is administered through oral or ingestion, and also inhalation, absorption, or also injection through the skin of a human. Next slide, please.
So for the lethal dose, it is the quantity of an agent that will or may be sufficient to cause death. There are numerous tables of toxic levels that have been published by experts and scientists. However, there is considerable variation between the level, upper and lower margin recorded. So, lethal dose, ibig sabihin, nakakamatay na dose. So, by that, sabi nga ni Catriona Gray sa sagot niya sa Miss Universe before, everything is good but in moderation. So, what is LD50? It is the amount of a material given all at once. So, lahat agad, which causes the death of 50%, one half, of a group of test animals used by pharmacologists and toxicologists in a statistical sense in animal experiments. The LD50 is one way to measure the short-term poisoning potential or acute toxicity of a material. So, by definition or by understanding, LD50 is the amount of material. So, half na material ay binibigay sa test animals to determine its toxicity, kung gaano siya ka-poisonous or lethal para sa isang tao if ever man ibigay. So, poisoning. It is known as the injurious effect caused by the action of a poison or a detrimental chemical substance. It leads to the development of adverse reactions toward harmful chemicals or drugs. So you can be poisoned by a lot of substances, may it be chemicals or drugs, may it be air, carbon monoxide poisoning, which will be discussed later. Its nature may be accidental, homicidal, or suicidal. It may be accidental na you left your engine running tapos nasuffocate ka dyan, carbon monoxide. Homicidal, sinadya kang lagyan ng rat poison sa pagkain mo. May it be suicidal, sinadya mong ikaw mismo mag-intake ng poison. So, poisoning deaths in hospital. Some of the people suspected of poisoning may have died upon arrival at the hospital, or dead on arrival, or while in the hospital, and it is important to take into consideration that the medical records of the patient must be obtained and studied before conducting an autopsy. The antemortem fluid samples collected when the patient underwent biochemical or hematological tests are typically stored in the hospital laboratory. and it may help in representing a more accurate maximum toxic concentration result than of the post-mortem one. So poisoning, so as we all know, when you get poisoned, you will have symptoms. So those symptoms, syempre, people will care, or you yourself will go to the hospital. There you will be tested through blood or urine about the toxicity level of whatever you may have intaked. So that is poisoning deaths in hospitals. So next.
Now we will be discussing some of the types of poisoning. So first, we have the alcohol poisoning. So alcohol poisoning is defined, is typically occurring when a person drinks a toxic amount of alcohol, usually over a short period of time, and being poisoned by alcohol can damage your health or even put your life in danger. Alcohol poisoning is a leading cause of poisoning in England, especially among young people. So we should take note that in most cases of alcohol poisoning, it is deliberate or yung intentional, since yung ating person is like intentionally siyang umiinom ng alak, for example, para magpakasaya or para magpaka-wasted. So in that short period of time, tapos nag-binge drink siya, he may be at risk of alcohol poisoning. And this type of poisoning rarely occurs accidentally. But when this happens, it is usually due to continuous inhalation of alcoholic vapors. Next slide, please. So alcohol poisoning can be present in two common forms, which is the first one is the acute or the alcohol intoxication, and the second one is the chronic or the alcohol addiction. So for the acute or alcohol intoxication, it is a condition associated with drinking too much alcohol in a short amount of time. So it affects your body's temperature as well as breathing, heart rate, and also your gag reflex. And it can also sometimes lead to coma or death. And the second one is the chronic chronic alcohol poisoning or the alcohol addiction, which is defined as the consumption of heavy doses of ethyl alcohol beverages for a long period of time. So, ang pinagkaiba yung acute is more on short period of time and in large amount, and yun namang chronic or alcohol addiction is long period or yung pangmatagalan tas regular kang umiinom. So it is characterized by a morbid desire to drink alcohol and also blackout episodes with intoxication and withdrawal symptoms on stopping alcohol consumption or yung bigla ang pagtigil ng sa pag-inom. Like for example, for a long period of time, let's say 1 month straight kang umiinom tas bigla kang tumigil. So that is one of merong mga side effects yung pag withdraw mo sa pag-inom ng alak. Next, we will be discussing the signs and symptoms of alcohol poisoning. So for the signs and symptoms of acute alcohol poisoning, so we should take note that alcohol intoxication is mainly because of its depressing action on our central nervous system, both in the higher and vital centers. So depending on the group of signs and symptoms observed, acute alcohol poisoning manifestations are described under 3 different stages. So we have here the stage of excitement, the stage of incoordination, and the stage of coma. So for the stage of excitement, so this stage develops with blood alcohol concentration of 0.05 to 0.1%, or in every 50 to 150 milligrams or 100 ml of blood. So in a non-addict person, there is a sense of well-being or euphoria. since ito nga yung, kumbaga yung kapag iinom ka, ito yung parang intro pa lang sa story, parang ganun. Kumbaga parang nag, nagpapahype ka pa lang. So, as the person enters the stage of excitement, there will also be changes in the behavior of the person. And ang unang nangyayari po sa ating stage of excitement is that the person may be free in action, speech, and emotion. So, he may also perform dancing, thrilling shows. Ito yung nangyayari typically, for example, is kapag nasa bar. So, pagkakasimula mo pa lang uminom, kumbaga parang kinakondisyon mo yung sarili mo sa pag-inom, and, you start to dance and, act carelessly and fearlessly. So, in this stage, a person might also disclose secrets, and there may be increase in confidence, but lack of self-control. So in the second stage, which is the stage of incoordination, this develops with a blood alcohol concentration of 0.15 to 0.25%, or for example, is 150 to 250 milligrams or 100 ml of blood per 100 ml of blood. So this is due to further depression in higher centers. So in this stage, or the stage of coordination, a person's recent event memories may be impaired, and the victims may show signs of incoordination or hindi niya ma-perform yung mga body movements na usually nagagawa ng isang taong sober. And there may be alteration in speech, or parang pautal-utal, or nagkakalito-lito na sa iniimik niya. And also, in terms of appearance of the person, ang kanyang itsura ay pwedeng magkaroon ng yung face flush, or yung namumula yung muka. And also, the breath of the person may smell alcoholic. So for the third stage, which is the stage of coma, the blood alcohol concentration required to develop this stage is not less than 25% at 0.25%. So, for example, is not less than 250 milligrams per 100 milliliter of blood. This occurs when both motor and sensory cells are deeply affected. So, kapag affected yung ating motor and sensory cells, it results to speech, yung ating way ng pagsalita is talagang hindi na talaga maintindihan, or parang more like murmur na yung mga iniimik natin. And the victim or the person may become giddy, and also yung patumba-tumba, since nag-undergo na siya ng incoordination, and yun nga ang body movements niya is hindi na niya makontrol. And he may undergo the stage of coma with heavy breathing, as well as hindi na stable yung pulse, and hindi na rin normal yung body temperature. Next slide, please. So we have here the term recovery. So unless a large quantity of alcohol is consumed in a short period of time, recovery is the rule. So with recovery, the coma gradually lightens into a deep sleep, and the victim will wake up in 8 to 10 hours with acute depression of mood and complain of having nausea and severe headache, etc., called an alcohol hangover. So recovery is the key for us to escape from the from being intoxicated by alcohol. So once a victim undergoes the stage of coma and then matulog siya, in 8 to 10 hours, like mag-exhibit yung signs na meron ka ng hangover. Tinatawag natin hangover, yung pagkagising is masakit yung ulo, and so on. Then we have here the term alcohol hangover, which is defined as yun nga, the throbbing headache, irritability, lethargy, nausea, and abdominal discomfort. Yun. So, yung alam naman natin, yung abdominal discomfort, usually nangyayari siya if yun nga, after drinking is sumuka ka ng marami or uminom ka ng walang laman yung stomach mo. And while the abdominal discomfort is due to alcoholic gastritis, the other symptoms are due to the effect of congeners and other impurities present in the alcohol beverages consumed, which causes mild cerebral edema. So yun nga, although meron na tayong alcoholic gastritis, meron pa ding instances na yung ating alcohol is hindi merong mga impurities, so it may lead to mild cerebral edema. So the hangover manifestations may also be partly due to alcohol-induced hypoglycemia. Next po. So for our post-mortem appearance, when a person dies from alcohol poisoning, is that the odor of alcohol around the mouth and nose, and upon opening the body, it is evident. And the clothes are in disorderly or torn conditions, and stains due to vomit or blood may be seen. Yan po, since yun nga, kapag nag-intake ka ng alcohol, usually ang reflex ng tao is isuka to kapag napadami na. And yun nga, if too much na yung pag-vomit, pwede magkaroon ng blood. Next is bruises are generally found on various parts of the body. So why do we think that magkakaroon ng bruises ang isang taong nag-undergo ng alcohol poisoning is dahil yun nga, since nag-undergo siya ng stage of incoordination or hindi na niya makontrol yung kanyang body movements. So yun nga, may instances na pwede siyang matumba or mapabagok or yung katawan niya unconsciously hindi niya alam na napatama sa ibang bagay. And other post-mortem appearance is congestion of conjunctiva, and the rigor mortis is also prolonged, as well as, however, the decomposition is retarded. So we now go to the signs and symptoms of chronic alcohol poisoning. So yung diniscuss ko po kanina is about sa acute alcohol poisoning, or yun nga pong pag-intake natin ng alcohol in a short period of time and in large amounts. So dito naman sa ating chronic alcohol poisoning, so the chronic alcoholic patient will suffer from a set of manifestations involving various systems and organs of the body. So this comprises the gastrointestinal system and the central nervous system. So ang pinakang affected or magkakaroon ng symptoms is yung ating GIT or the gastrointestinal system, yung we may experience frequent stomach pains, yung parang laging nangangasimang tiyan. And yun nga, since alcohol, a person may be addicted to alcohol dito nga sa ating chronic alcohol poisoning, so it can affect their central nervous system. So as for the treatment in the chronic alcohol poisoning, successful treatment of chronic alcoholism requires careful planning and proper supervision of a regime of treatment coupled with a sincere intention of the addict to give up the habit of drinking, which can be successfully carried out in an organized institution or nursing home. So bakit po ba natin kailangan ng careful planning when it comes to treating a person with alcohol addiction? Is dahil nga katulad na nabanggit ko kanina, kapag biglaan yung ating pag-withdraw sa pag-intake ng alak is pwedeng magkaroon pa to ng adverse or negative effects sa ating katawan. So the first treatment of chronic alcoholism is the psychotherapy. So psychotherapy, ang pinakang ito kasi is administered, pwedeng individual psychotherapy and pwedeng group therapy. So usually mas okay kapag group therapy, and in some places there is no payment or membership fee sa pag-undergo ng psychotherapy as long as the person or yun yung addict is ready to give up the habit of drinking or yung desire to stop drinking is high. So next we have treatment of withdrawal. So in the treatment of withdrawal, like I've said, ito ay dapat meron pa rin supervision ng medical expert. So sa withdrawal, pwede po magreseta ang doktor ng drugs to help the person in treatment of withdrawal. So some of the drugs include carbamazepine, chlormethiazole, and clonidine. So for the aversion therapy, this is the alcohol detoxification therapy, and this usually needs hospitalization. So for the post-mortem appearance of the chronic alcohol poisoning, so as I have noted, ang pinakang affected na part is yung gastrointestinal system body. Therefore, the gastric mucosa is deep reddish brown with patches of congestion or effusion and is hypertrophy. So the liver is also congested and shows fatty infiltration, enlarged or cirrhotic or contracted. So yun nga, ang pinaka kasi isa din sa pinakang affected na organ natin when it comes to taking alcohol is our liver. And our kidneys in the postmortem appearance shows granular degeneration. Ang effect naman nito sa heart natin is that the heart becomes dilated and shows fatty degeneration. And ang effect sa brain is shrinkage of the cerebral cortex or the gray matter. And it is commonly seen in chronic alcoholics. Next slide.
So, good morning again, everyone. So, for the carbon monoxide poisoning. So, what is carbon monoxide poisoning? It occurs when carbon monoxide builds up in your bloodstream. When too much carbon monoxide is in the air, your body replaces the oxygen in your red blood cells with carbon monoxide. This can lead to serious tissue damage or even death. So, what happens is, instead of getting oxygen into your lungs, into your body, it becomes replaced with carbon monoxide. Hence, you become poisoned because alam naman natin na carbon monoxide is not good for us. So what is carbon monoxide? Carbon monoxide is a colorless, odorless, tasteless gas produced by burning gasoline, wood, propane, charcoal, or other fuel. Improperly ventilated appliances and engines, particularly in tightly sealed or enclosed spaces, may allow carbon monoxide to accumulate to dangerous levels. So that's how carbon monoxide occurs in a certain space na accumulate siya, naiipon siya in a certain area. Then, yan na lang yung ating mabe-breathe in. So what are the signs and symptoms that you're experiencing carbon monoxide poisoning? So you will feel a dull headache, a weakness, nanghihina ka, dizziness, nahilo ka, nausea or vomiting. It's the feeling of wanting to vomit, or you actually vomit. Then shortness of breath, hinihingal ka, confusion, nalilito ka na, blurred vision, syempre, self-explanatory, loss of consciousness, nawawalan ka ng malay. So, carbon monoxide poisoning can be particularly dangerous for people who are sleeping or intoxicated. Why is that? Kasi, syempre, kapag, for example, may sunog, tapos natutulog ka lang, most victims doesn't die from burns, but they die from carbon monoxide poisoning. Natutulog ka, hindi mo alam na may sunog pala sa labas ng kwarto mo. Air fills up with carbon monoxide, tapos wala, masarap tulog mantika ka. So, while sleeping, you inhale carbon monoxide instead of oxygen, then you die in your sleep. So people may have irreversible brain damage or even die before anyone realizes there's a problem. Kasi diba, it's odorless, it's colorless. So hindi mo malalaman na may carbon monoxide na pala. And not until you experience the signs and symptoms. And sometimes it may be too late for you. So the post-mortem appearance. Oh, what does it look like when you die of carbon monoxide poisoning? Except for the well-known cherry red color of the hypostasis in lungs, so magiging cherry red color ng lungs mo, brain and the other organs, and the very fluid cherry red blood after fatal carbon monoxide poisoning, intoxication usually produces discoloration limited to the skin or nail beds. So aside from that cherry red color sa lungs mo, sa brain, and the other organs, ay makikita rin sa skin mo and sa nail beds, sa kung saan yung nails niyo, makikita na may discoloration. So it will not be pink, it will be bluish or purple. So for the cardiac poisoning.
And move on to poisoning, which is the cardiac. So for the cardiac poisoning, next slide, please. It is caused by cardiac poisons that affect the actions of the heart, either directly on the musculature or through its nerve supply, and produce deleterious effects on the action of the heart due to poisoning of the cardiac muscles or its conducting system. So yun nga, from the term itself, cardiac poisoning, it is poisoning that mainly affects our heart, including the cardiac muscles and yung mechanism ng pag-flow ng blood. So these cardiac poisons, we included 3 poisons. First, we have the digitalis purpurea, or the foxglove, and the hyoscyamus niger. And number 3 is the nicotine. Next slide, please. So we have here digitalis purpurea, or what we call as the foxglove, which is a poisonous plant where the roots, leaves, and seeds contains several glycosides, which include digitoxin, digitalin, and digitonin. So they act directly on the heart muscles and improve the function of a failing heart. The normal heart is affected very little, or konti yung nagiging effect niya sa heart, unless yun nga toxic doses na yung in-administer dun sa isang tao. So we have here the signs and symptoms of ingesting digitalis purpurea. So here we have the central nervous system changes. So ang pinakang nagiging changes pagdating sa ating CNS is that we experience a severe headache, drowsiness, vision disturbances, confusion, hallucination, tremors, and convulsions. So these symptoms are self-explanatory. And second one, we have the gastrointestinal symptoms, which includes mouth and throat pain, nausea, vomiting, cramping, abdominal pain, and diarrhea. So for the third one, we have the hyperkalemia, or the higher potassium levels, and the dysrhythmias, just like arrhythmias, it makes the heart not beat at the regular rhythm. And last symptom is that a person who ingested digitalis purpurea or foxglove may have a heart block. When it comes to the fatal dose, next slide, please. The fatal dose of of intaking digitalis purpurea is that it should be around 15 to 30 milligrams of digitalin or 4 milligrams of digitoxin. And a person can die from ingestion about half an hour to 24 hours. And when it comes to the postmortem appearance, or when a person dies from ingesting this digitalin and digitoxins, is that the gastric mucosa is irritated and there may be leaves or seeds found in the stomach. So the color of these seeds are usually reddish brown, and in terms of size, it is small and angular, has an angular shape with peculiar markings. So cases of cardiac poisoning through this cardiac poison are typically accidental in nature, because it may be due to overdose of medicine or eating the leaves by mistake. So therefore, the cases of homicide and suicide here in this type of poison is rare. Next slide, please. We have the black henbane, or the Hyoscyamus niger. So it has a long history of being a notorious toxic as well as a beneficial medicinal plant. So kagaya nga na nabanggit ko kanina, the poison is not the substance or the thing itself, but rather the amount which is administered. So this black henbane poses both toxic and beneficial effects on the ones who intakes this. So this plant is a pale yellow bell-shaped flower with purple veins, and is highly poisonous and should not be carelessly used even by herbalists. So yun nga po, although meron nga siyang beneficial medicinal effects sa tao, it should still be not carelessly used. And other term for this plant is this scopolamine, and this typically grows in the Himalayan ranges, and almost all parts of the plant is poisonous, and they contain alkaloids like atropine, hyoscine, and also hyoscyamine. Next, we have the signs and symptoms of a person who suffered from poisoning of this cardiac poison. So it closely resembles that of datura, which is a delirium poison that stimulates and depresses the virtual centers. For the fatal dose and period, an adult can die from this poison upon ingestion or upon ingesting 125 milligrams of hyoscyamine. And when a person has ingested a hyoscine hydrobromide, it usually takes around 15 to 30 milligrams, and a person can die within 24 hours. So for the postmortem appearance, just like digitalis purpurea, the seeds may also be found in the stomach, and hyoscyamin resists putrefaction. Next po. So our last cardiac poison is the nicotine, which is a substance found in all products and some e-cigarette liquids. It is a highly addictive substance found in the tobacco plant, and it may be produced synthetically. So the nicotine is from the tobacco plant Nicotiana tabacum, and the dried leaves are typically chewed, or it may be used enough for, and its main uses is, as we all know, for humans, and it may be also used extensively in agriculture as fertilizers, fumigants, and also insecti-horticultural side sprays. So for the active principle, all parts of the plant except the ripe seeds contain the alkaloid nicotine. Next po. So for the signs and symptoms of a person who suffers from nicotine poisoning is that in the early phase, he may experience nausea and vomiting, which occurs in more than 50% of people with symptoms of nicotine poisoning. And second one, we have the increased salivation as well as abdominal pain, sweating, rapid heavy breathing or hyperpnea, and as well as loss of full control of body movements or ataxia, loss of balance, and difficulty walking. We also have headache and dizziness, as well as much muscle twitching. So when it comes to the late phase of nicotine poisoning, a person may experience diarrhea, low blood pressure or hypotension, and slow heart rate or bradycardia. There may be also exhibition of abnormal heart rhythms as well as shock and coma. And the muscles may be weakened and may also experience paralysis. And when it comes to respiration, there may be shallow breathing as well as difficulty in breathing, and there may be respiratory failure. Next slide for the fatal dose. So for nicotine to be fatal, it must be around 60 milligrams or 2 grams of tobacco. So one cigarette contains 1 gram of tobacco, and which is about half the lethal dose. So a teaspoonful of insecticide is fatal. So for the fatal period, in a few minutes when nicotine is swallowed, in some instances, it may be delayed, or the symptoms or the effects of the poison may be delayed for a few hours. When it comes to the post-mortem appearance of nicotine, so the smell in the stomach is evident, and there is a brown discoloration of the wall or the skin of the stomach, and there may be also gastric irritation and pulmonary edema. So similar yung effects nitong pag-intake ng nicotine sa postmortem appearance ng person na nag-suffer from asphyxia. So just like the other one, the cardiac poison that was mentioned, nicotine also resists putrefaction. So we should take note that nicotine is a drug of addiction, as we all know, and it leads to psychological dependence. So yung chronic use or yung pagiging ng addiction ng ating nicotine can lead to disability as well as lower life expectancy. And it is more commonly occurring accidentally. So kapag ang isang tao is nag-suffer ng accidental poisoning sa nicotine, ito ay dahil or pwedeng naparami yung kanyang dosage, as well as nagkaroon ng absorption sa skin kapag kapag applied as poultice, and yung excessive smoking ng ating tobacco and exposure to fertilizers, insecticides, and fumigants will also pose a risk of being in a accidental poisoning of nicotine. Next po.
So for the drug toxicity, So what is drug toxicity? Drug toxicity refers to the level of damage that a compound can cause to an organism. The toxic effects of a drug are dose dependent and can affect an entire system, as in the CNS or central nervous system, or a specific organ, such as the liver. Toxicity is the degree to which a chemical substance or a particular mixture of substances can damage an organism. The examples are methamphetamine, which is the shabu, ecstasy, cocaine, marijuana, and fentanyl. So the methamphetamine. Most meth-related deaths occur when the body suffers from heat stroke, which ultimately results in multiple organ failure. A meth overdose can also cause a sharp rise in blood pressure that leads to hemorrhage, as well as liver failure, or in very rare cases, lead poisoning from contaminants in the illicit drug. So, as discussed, meth-related or shabu-related deaths are suffers from heat stroke, which causes multiple organ failure. So, una, tataas yung BP mo, that can lead to hemorrhage, may it be in your brain, or liver failure kasi masyadong madami na yung amount of toxic substances in your body, or very, very rare cases, lead poisoning sa contaminants. Ibig sabihin, not in the drug itself, but what the drug contains. So what are the signs and symptoms if you are being overdosed in methamphetamine or shabu? So you will experience chest pain, naninikip yung dibdib mo, arrhythmias, irregular heartbeats, or hypertension or hypotension, mataas ng BP mo, or sobrang baba naman ng BP mo. Difficult or labored breathing, hihirapan ka na huminga, agitation, parang napapraning, hindi ka mapakali, hallucinations, kung ano-ano nang nakikita mo, ano-ano nang naririnig mo. So, psychosis, feel mo nababaliw ka na, seizures, your whole body shakes, rapid or slow heartbeat, sobrang bilis naman ng heartbeat mo or sobrang hina ng heartbeat mo. Then, hyperthermia, or yung sobrang init mo. So, what is the post-mortem appearance if you overdosed in shabu? The use of the illegal stimulant methamphetamine causes a buildup of tough protein fibers in heart muscles, which may help explain the development of enlarged hearts and heart failure in users. So, sabi nga, di ba tumataas yung BP mo, there will be a cause of tough, tinitigas yung protein fibers sa heart muscles mo. Which, kaya nga kapag gumagamit ka ng shabu or drugs, there is a very high chance that you will develop heart diseases or any sort of heart-related problems. So you will have enlarged hearts or you will die of heart failure. Previous autopsy reports of some meth users have documented injury to heart cells, scarring of heart muscles, and enlargement of the heart. So, ecstasy, or methylene deoxy and methamphetamine. Ecstasy is a synthetic psychoactive drug that can alter mood and heighten sensory perception. It is often taken in clubs or rave settings for its euphoric effects. Ecstasy, saying na it can alter your mood. It's an upper. Papabrighten niya yung mood mo. Kaya, tinitake siya in clubs or raves. It looks like a little candy. Tapos, parang papasaya ka, makakaitin yung perception mo. Ganon. Though its addiction liability may not be as pronounced as some other drugs of abuse, such as heroin or cocaine, The drug is associated with the potential for increasingly problematic patterns of use and dependence development. So, hindi man daw siya ganon kalala or known as in abusing it, such as the heroin or cocaine, but it still leads to problematic patterns of use and dependence development. So, what are the signs and symptoms that you're experiencing ecstasy overdose? So, you will have abnormal heart rate and rhythm. Your body temperature dysregulates. Naiiba-iba yung yung temperature ng katawan mo. You will experience hyperthermia, sobrang init mo. Hyperthermia-related rhabdomyolysis or muscle breakdown and kidney injury, then you will have seizures. So, what is the post-mortem appearance if you died of ecstasy overdose? Striking changes are identified in the liver, which vary from foci of individual cell necrosis to centrilobular necrosis. Histologically, the changes in the heart range from contraction band necrosis to individual myocyte necrosis with the surrounding neutrophil and macrophage inflammatory responses. The same changes as have been described in catecholamine-induced myocardial injury. The brain of one of the cases of rapid death showed disseminated intravascular coagulation, or DIC, edema, and degeneration of neurons, particularly apparent in the locus coeruleus. So, makikita daw sa brain, sa locus coeruleus, yung may edema or build-up ng fluid sa brain mo. And then, there will, sa liver mo, makikita na sobrang, madaming pagbabago sa liver mo, may it be in color, shape, or appearance in itself. Sa heart mo, there will be surrounding neutrophil and macrophage inflammatory response. So, nag-inflame. So, for the next one, cocaine. What is cocaine? Cocaine can bring on feelings of euphoria. Papasaya ka daw. Foster increased alertness in the user. Masyado kang ma-heighten yung senses mo, parang nagiging alert ka pa daw lalo. Result in hypersensitivity to outside stimuli. So, masyado kang sensitive sa mga bagay-bagay. For example, nag-change lang yung temperature, mararamdaman mo agad. May narinig ka lang sa malayo, dinig mo agad. You'll be hypersensitive to everything around you. While there can be both negative psychological and physical effects in the short term, as well as the long-term consequences, the most immediate danger associated with cocaine is overdose. So, madami siyang effects, harmful effects in your body, but one of the most immediate danger is overdose. So, what are the signs and symptoms of overdose in cocaine? So, you will have elevated heart rate, rise in body temperature, nausea and vomiting, as explained what they are, pain in the chest, tremors, nanginginig ka, panicked feelings, parang papraning ka, anxiety, panic feelings, napapraning ka, masyado kayong napapa-overthink ka na masyado, or feel mo nasa panganib ka lagi, delirium and paranoia. So, what is its post-mortem appearance? Myocarditis occur frequently in patients dying of cocaine abuse and may represent microvascular injury. Microvascular meaning sa kaliitan sa vascular mo, sa myocarditis puso mo. So, next is marijuana. What is marijuana? It is a CNS or central nervous system stimulant. Its cultivation is restricted by law, and all parts of plant are poisonous. So, lahat ng parte daw ay poisonous sa marijuana or cannabis. Madaming tawag sa marijuana. may it be Mary Jane, MJ, or many other words. So what are its active principles? Its active principles are fat-soluble oleoresin or cannabinol, tawag, stored in fat cells of the body and acts like a time-release capsule. So, hindi siya agad-agarang e-epekto kapag tinake mo siya. You can take it, you can ingest it, or you can inhale it. Ingesting it, ihahalo mo siya sa pagkain, and or most commonly in brownies, they call it pot brownies. So, hindi siya agad-agaran na pagkakain mo ay dediretso na mararamdaman mo agad. Tapos, it can take mga siguro 30 minutes to effect or 10 minutes. The effect of a single dose lasts 7 days. So, isang take mo lang, it can take you up to a week na mararamdaman mo siya. So, signs and symptoms na you have nag-intake ka ng marijuana. So, you will have high levels of anxiety. You will have tataas daw ang level ng anxiety mo, or kakabahan ka, or mapapaning ka. You will have a panic attack because of that anxiety. You will have rapid heart rate, then, or mabilis yung tibok ng puso mo. Difficulty conversing, or mahihirapan ka na makipag-usap sa iba. Tapos, poor coordination. Like, hindi mo na mahawakan yung mga baso, hindi ka na makasalo ng mga bagay-bagay, ganun. High or low blood pressure, yung BP mo daw tataas or sobrang bababa. Nausea and vomiting, then you will have extreme confusion. Malilito ka, mako-confuse ka, and memory problems. So, hindi mo na maaalala anong ginagawa mo. Tapos paranoia, mapaparanoid ka, and then hallucinations. Mag-hallucinate ka, may makikita ka ng mga bagay-bagay. May kinakausap ka pero wala naman pala. So lastly, the fentanyl. Fentanyl, which can also be spelled as fentanyl now with an I, is a potent synthetic opioid similar to morphine. Morphine is a drug na binibigay in hospitals. It is a strong analgesic, but produces analgesia to a greater extent. Yeah, analgesic. Clinically, its most frequent use is as a sedative in intubated patients and severe cases of pain in patients with renal failure due to its primarily hepatic elimination. At times, clinicians may also use fentanyl to treat chronic pain patients who have developed tolerance to opiates. When used as a sedative, it is most commonly administered as a drip, owing to its versatility and titration scenarios. So fentanyl is a much stronger analgesic than morphine. Ito yung sa mga na-immune na or hindi na kaya yung pain, like hindi na talaga tolerable na, for example, as I have read, yung 100 grams 100 grams na morphine is just equivalent to 10 milligram of fentanyl. That's how strong it is. But ayun nga, you should be very mindful of the use of this, especially in doctors in administering it, because it still can cause overdose in patients. So what are the signs and symptoms of fentanyl overdose? So you will have constricted pupils. Yung pupils mo ay liliit. Severe respiratory depression, magiging slow or shallow yung breathing mo. Then you will have cold, clammy skin. Then its color will be gray, blue, or very pale. Mamumuti ka or parang gray na, close to bluish. Then you will have blue or purple lips and nails. Para kang tuloy na galing sa freezer sa mukha mo, na magiging blue or purple yung lips mo, magiging gray yung katawan mo, or blue, or very pale. Then you will have respiratory arrest, or titigil na yung paghinga mo. And then extreme decreases in the level of consciousness. So bigla-bigla kang mawawala ng malay. Then you will have limp or flimsy arms and legs. Yung parang wala nang talagang strength yung arms and legs mo. Then you will have slurred speech or inability to speak. Slurred speech meaning para kang nabubulol or hindi ka na makapagsalita na maayos. You have the words in your head but you can't let it out. So you will have loss of consciousness. Mawawalan ka nga ng malay. Unresponsiveness, hindi na nagre-respond yung body mo. For example, if hahampasin yung tuhod mo, you will have a jerk motion effect. But wala nang respond, or even your eyes will not respond to light, and you'll vomit, or making choking or gurgling sounds. So what is its post-mortem appearance? So in marijuana, its post-mortem appearance is nothing. No fatalities from cannabis or THC overdose have been reported. So wala pang, as we have researched, wala pa daw namamatay sa overdose of marijuana. In fentanyl, you will have pulmonary edema present, or you will have fluids in your lungs. So for our takeaway notes,
So again, the different types of poisoning that was discussed earlier includes the alcohol poisoning, carbon monoxide poisoning, cardiac poisoning, and drug toxicity. So note that the different types of poisoning discussed earlier were only a small portion of the topic poisoning, and there are many more types that were not discussed because it requires an extensive presentation, and it has many different types like delirium poisons, irritant poisons, corrosive poisons, and many more. So it requires days or even weeks to fully discuss all those subtopics of poisoning. So we just chose 4 different types. Next one.
so one takeaway note is there is no exact lethal dose, as there are variations, and it depends on different circumstances. Like how there are instances where more cases of survival in the upper margin occurs, while there is minimal survival and even death cases in the lower margin. So as we said, lethal dose varies from person to person, and it have many variations and depending circumstances, like the weight of a person, or if may sakit na ba dati yung person, or may nararamdaman ba siya, or may hinalo siya sa ininom niyang substance or drugs. So lethal dose varies, and it doesn't have a certain amount na objectively. So that ends our presentation, and thank you for listening. And these are our references. Thank you so much.
Okay na?
Yes po, Doc.
So,
Mag-tick kayo ng attendance sa LMS. So, next meeting, last meeting na. Hello?
yes po.